You're probably wondering, why are we talking about nutrition? I mean, you're a chiropractor, you adjust spine, you take care of the body. Nutrition is actually quite important because what we eat, we are. We put in garbage, we let out garbage. We eat healthy, we become healthy. The importance of nutrition is because of aging. We'll say 10 years from now, we're gonna be better than 10 years before that. That's not true. 10 years, we're hoping that we're gonna still sustain that youth, longevity, as long as possible. And as we age, we wanna actually age well. Okay, chronological age is when you celebrate birthday every year. Biological age is how your body ages. A person can be aging as the time goes by and their body is still youthful. Or a person could be very young and the body's just falling apart. And how we age well is partly because of nutrition. Now, we're living longer and longer as the time goes by. So for instance, long, but also very, very healthy. When we're younger, for the most part, our potential is the amount of gift and energy that we have in our body. When we're younger and we don't have a whole lot of genetic problem, our potential is way up here. That's when we can do everything and we feel great. As we get older, our potential starts to get a little bit lower with time. Sometimes we get too busy and we say, you know what, I'm just too busy to take care of my health, and they just kind of let it go. With aging, our body starts to develop arthritis, degeneration, sickness, and deterioration. Unfortunately, some people, as they get older, they get bedridden. But there are others who are, even though they're older, their potential is still up here. So why is it that one person could be up here and the other person can be here? Because these people have a forethought to focus on nutrition, exercise, self-care, attitude, and environment. People nowadays on videos and YouTube, and you see some young people doing flips and acrobatics. I look at them and goes, you know what? Great, you're young and energetic. So it doesn't really impress me. The people that actually impress me the most are these type of people. Up there in age, 2 out of these people I personally know, and then 3 of them I don't know, but I actually follow them. Is my father. He's an 86-year-old man. He's a grandmaster, and he has been training martial arts since he was 3 years old. He actually educated me and my brother, who's also a chiropractor, to eat well, healthy, be active, take care of your body, so that way you can last a long time. So when I look at my dad, who's 86 and is still very vibrant and active, I say, wow, I look up to him. And so I said, what is it that he's doing so I can replicate to his age? I can still live like him or be close to him. He's a 99-year-old and he's a marathoner. He's still running. Centennial age and he's still running and training. And a lot of it's got to do with exercise, but also nutrition. He is actually in his 70s. He's 75 years old. He works out regularly, but I watch his diet. He eats very clean. Here, she was actually on Vogue. She was 106 years old. She's still alive, and she's a tattoo artist. Can you imagine she's 106 and she's able to take a small pen and just tattoo art? I believe if we don't use it, we're gonna lose it. If we don't use our mind, our brain will go. If we don't use our body will go. What keeps these people at this age keep going is because they need the fuel, the nutrition, the movement, and energy. Now, commonly held theories of age. The first one is wear and tear. The more we use it, the more damage that we're gonna get. I don't believe in this completely. Wear and tear does not apply if you take care of yourself. Second theory is neuroendocrine theory, hormones. At youth, we have high testosterone, estrogen, growth hormone. Everything is peak. You have all these energy. But as we get older, we start to feel more fatigue, more tired, and typically there are something called bioidentical hormone replacement. There are some supplements and vitamins that could actually kickstart your own metabolism. Third is genetic control theory. If we have a certain gene that's a problem, we're predetermined to have that problem. There's a gene called ApoE4. That gene, it gives 55% chance that the person is gonna get dementia. However, 35% is something that you could change, meaning education, hearing loss, hypertension, and weight gain in midlife. If we can control that, smoking, depression, physical inactivity, social isolation, diabetes, that counts for 35%, meaning if you did all of this wrong, you have 100% chance of getting dementia. So this is an answer of nature versus nurture. Free radical theory. So what this means is through metabolism, through our living, we produce damages. So when we exercise, we produce byproducts. When we eat food, it creates, it's called oxidative stress. So, a lot of times, whatever we do, whatever we eat, whatever we exercise, our body is constantly damaging. You eat bad food, you don't have proper supplement, you don't actually re-nourish yourself, those damages can cause more problems. So the answer to that is you need good antioxidant supplementation. How do we attain healthy body? Nutrition and supplements is very important. You need to rest. You need to allow your body to just relax. 3, you need to be active. You need to exercise. Number 4, mind and stress management. Mental stress is there. It causes huge amount of problem. Number 5, environment and healthy social. How do we measure health? If their frame is strong and their joints are strong, you get the impression this guy's pretty healthy. But if the person's frail and crippled up, then that in itself already tells them this person's got some health. Second is integument, skin, aging spot, a lot of damages, a lot of deterioration. Then you can actually say that person's healthy or not. 3 is cartilage and joints, our knee. The person's knees are all buckled or it's got that curvature. Number 4, hormone, their metabolism, their muscle mass, their leanness. Water, good. Men should drink roughly 12 cups, almost 3 liters. I carry this around everywhere. Women should drink about 2.2 liters, about 9 cups. So the best type of water, spring water, filtration. You know, one of those water filters. I believe in balanced diet. I believe eating enough protein, carbs, that's complex, and fruits and vegetables. According to the recommended food pyramid, you need about 3 to 5 servings of vegetable and 2 to 4 servings of fruit per day. However, it doesn't differentiate between the fresh fruit and vegetable and canned fruits and vegetables. It's the same, but they're not the same. Try and go for fresh fruits and vegetables. Recommendation is just to keep your body just alive. So in order to actually really enhance your optimal level, 2 to 3 times more, take roughly 6 to 10 servings of vegetables and 4 to 8 servings of fruits. That's a lot of fruits and vegetables. On top of that, we also have a little bit of problem. Nutrition is different compared to 50 years ago. You could be eating 2 to 4 servings of fruits and vegetables. You're getting 50% less nutrition from the same fruits and vegetables. Why? Because of rapid farming. They deplete the soil quicker, it means you don't have enough mineral. Genetically modify organism to keep their shelf life longer. Those things have a lot of chemicals that might not be good for our body. Plus, you're not getting the nourishment. So organic is the best way to do it, but organic is very expensive. We have a dilemma. We need to eat a lot of fruits and vegetables, 2 to 4 times more, but we have less nutrition. So how do we solve this? Now, the type of food is also very, very important. When people talk about fat, they think fat is bad, right? There is such thing as good fat and bad fat. The good fat is unsaturated fat, omega-3, omega-6, and 9. But when our diet is always this kind of food, it elevates bad cholesterol, reduces good cholesterol, your blood sugar continues to stay high in your bloodstream, it creates insulin resistance, leading to diabetes. Now, another thing, who stresses out? Everyone stresses out, right? In the olden days, when we stress out, it's because we got chased by a tiger. You're ready to run away or fight it, right? So our sugar level is released, we have instant energy, and we use it through physicality. Nowadays, when we're stressed out, it's about life, school, money. But we're not running. What are we doing?
Sitting.
We're sitting. When we're stressed out, what do we do when we're stressed out? Let's go for chocolate. Let's go for chips. They reach for something that's quick sugar, simple carbohydrate. Bloodstream is increased with sugar. And all of a sudden your body goes, I have too much sugar, and the cell goes, no more. So they become insulin resistant, leading to diabetes. Now, I'm a chiropractor. I deal with bone, joint, cartilage, and muscle. Glucosamine, chondroitin, MSM, those are building block for your body to slowly use it and repair the cartilage and reinforce what you did. If the person has knee issue, taking glucosamine while the knee is twisted will not work. Untwist the knee, allow the body to be strong, then put stuff that your body can use to help repair. So that's my job, is to treat people, make them stronger, and people take the supplement to help. Is the knee doesn't have blood vessel, it relies on motion. And through that motion, it has synovial fluid to help nourish these cartilages. When the joints don't move, these cartilage wear down, leading to severe arthritis. So how do we take care of joints that doesn't have blood supply? So nutrients such as glucosamine, chondroitin, MSM, collagen will make your body metabolize something to your joint to heal. The type of supplement and how your body absorbs. Now, after that's done, you need to start exercising. You need to build the muscles because the muscle is anti-gravity effect. I also get PRP done on my knee joint. So modern life's challenges, we have lower nutrient food, harmful and toxic effect of unhealthy diet, sedentary lifestyle, we sit too much. Chronic stress also affects our digestive tract problems. And these things does not allow your body to consume proper nutrients. That's the answer. We need to take supplements. How do we choose good supplements? You know the one-a-day ones? Take one, it should be good. There's too much deficiency, and I'm going to tell you why. Second, try and choose vitamins that's more capsule instead of tablet. Tablet has too much fillers and binders. They stick it together, and a lot of these don't absorb into your body. You need to have a label that's called full disclosure. It tells you exactly what it's in there. And also trace minerals such as vanadium, boron, chromium. These are very important for metabolism. Now, avoid low quality forms such as carbonate and oxide. Have best form that's in citrate, aspartate, glycinate, and picolinate. The vitamin B complexes should be in active form, meaning they're like phosphorylated. So vitamin D, they should be in natural form, organic form, not synthetic. Multivitamin does not replace good diet. It's what you call full disclosure labeling. Vitamin C, it says absorbic, doesn't say acid, palmitate. Vitamin E, D-alpha tocopherol, organic form, not synthetic. Vitamin B6, riboflavin 5-phosphate, activated B form. B2, full disclosure, vision health, brain health, activated B complex for cellular, nervous, muscular metabolism, bone health, chromium picolinate, weight management, boron for bone and hormone, alpha lipid antioxidant, turmeric for joint health. Very good broad vitamins to hit all markers. Good base. Now once this is done, a person needs extra vitamin for vision, then you get extra. You need extra stuff for your joints, then you need extra. Don't absorb. Take ones that's going to absorb and be healthy for you and have good diet. That way your system is clean. So if you look at the comparison, this is a full disclosure and this is the generic disclosure. There is definitely IV from hospital where a person's sick, burn victim, they need to take medication, they need to put the medication and nutrient into the body to flush out the system. But there's also IV for health and wellness. I get IV done once a month. I ask myself, okay, what are things that I'm doing? I'm exercising, I'm stretching, but I also need to kind of work on this. I need to eat better, I need to exercise more, I need to take some supplements. But every once in a while, I go through some stresses. There are times where I just feel like run down, but that's when I actually get IV done. What is IV? IV stands for intravenous, meaning it goes directly into the vein. So it delivers quick fluid, nutrition into the bloodstream without going through your mouth, into your stomach and digestive tract and pulling out the nutrient. It bypasses all this. IV should be done properly. They use is by a company called Farsk, and this company mixes and prepares the bag in their lab. And each one of the bag is Health Canada approved with individual DIN number, drug identification. They're all vegan, no animals. They are very stable, and they don't have toxic plastic like PVC. It's done by nurses. It's a trained, registered nurse, licensed practicing nurse who actually does it. Now, before this is done, we need to also take patient's health information, send it to a medical doctor, and the medical doctor looks through it, and if there's any red marker, they give me a. So who should not get IV? People who are constantly influencing alcohol and drugs. People who are pregnant and breastfeeding, you need to talk to your doctor. People who have severe kidney, chronic diseases, trouble, blood pressure, that has instability, we don't want to do that. One is Boost. The Boost IV is good for dehydration. So let's say you're playing golf on a hot summer day or working outside, you're dehydrated, your electrolyte is reduced, dehydration, hangover, burnout, and fatigue. It has a lot of electrolyte. It optimizes the blood flow, sugar metabolism. Second type of IV is energy IV. It helps with production of energy called ATP. It's good for people who are really working out, to lose weight, increase energy, reduce exhaustion, and it helps out with training, which is this next one is my favorite. It's called Radiant for skin health. Skin has collagen. Skin has stuff that makes your body elastic. But guess what? Your joints also have collagen. Your ligament also have collagen. So it has amino acids that are high ingredients, which is good for arthritis, cartilage, ligaments, but it also works well with skin health. I just want to show you a quick video of how the IV looks like. So it's done here. Those are the chairs. Comes in, they do the blood pressure cuff measurement to make sure everything's good. They actually do the measurement, make sure that you're stable. And they're trained to do IV. These nurses do IV at hospital all the time. It's like walking in the park for them. And it only takes me 30 minutes. So they can actually control the drip rate depending on what it is. So how do you know if you need it? So how do we measure health? 4 things. What did I say? It's a test. The structure and joint, I checked you already. Hormone, blood test, and also metabolism. Skin, everyone looks very youthful, but I don't know for sure. Orange has this cool machine. It's called Visha analysis. It takes a picture of your face, front, side, kind of all around. It measures pigmentation, age spot, wrinkling, oxidative stress, UV ray. Can it be reversed? What can I do to improve it? The esthetician who specializes in skin gave me recommendations to use. How to take care of my skin. What kind of vitamins is good for the skin. And what kind of care that I can do at home, but also here. So I did that. And I did the recheck again, 6 months later. It improved 35%. All my sons who are young, who are 15, 17, and 22, and I keep telling them, and this is a guy who didn't believe in skincare before. He says, make sure you wear sunscreen. Make sure you take care of your skin. Make sure you use these lotion. Make sure you eat less saturated fat. Okay? I'm telling them that, and because they're doing that at young age, by the time they get to 50, I think their skin's gonna be better. But I just wanna say, I appreciate for everyone coming today. I know hopefully you learned some good information. Thank you for your time.
Thank you.